So I wanted to discuss pre-purchase exams quickly here, because I think it's a topic that if you don't really think about it too much or even know, it's not something that would come up. But I think that it's something that a lot of people should think about when they're thinking about purchasing a horse. So I'm just going to go through what happens in the pre-purchase exam. So basically, horse comes in. The first thing I do is have a conversation with the person that's looking to buy the horse, talk about what their expectations and their plans are for that horse, and then talk to the seller as well if they're able to be there and get the history of the horse, all the medical history that's available for that horse, to get the most amount of information that we can. The next thing that I'll do is go through a physical exam of the horse, listen to the heart and lungs, identify any heart murmurs that might be present or arrhythmias, look in the eyes, look for cataracts or any other eye problems that might be a little bit hidden that you might not notice. Look in the ears, look at the teeth, look at all those things that you might not notice just looking at the horse yourself. You always look for any scars from previous surgeries. A colic surgery scar is something that can be not easily noticed and you might pick up on a pre-purchase exam. And then I run my hands all over that horse, check all of the legs, any evidence of previous trauma, any evidence of any problems with the legs on that horse. We do a full hoof tester exam, checking all 4 feet for any signs of pain on pressing on the feet with hoof testers. And then a neurologic exam as well, any signs that the horse doesn't know exactly where its feet are in space or know exactly what's going on neurologically. We then watch the horse in motion, both at the walk and the trot, in a straight line on hard ground and then on soft ground as well. And then we watch the canter on the soft ground as well at the lunge. And we try to do all of those things, and the most helpful thing is when we can do it in a place that has a really good hard ground to evaluate the horse. So we can do these when there's only an arena with soft ground to look at the horse, but it's really helpful to be able to watch them on hard ground, because in this circumstance you really want to give the horse the toughest test, that if it's going to be lame under any circumstance, we want to pick that up on this exam. And then we do flexion tests, so picking up the leg, holding it in flexion for 30 seconds, and then trotting the horse off. And sometimes a horse that's not lame in a baseline exam will be lame after you do that flexion test, and so that's something that's important for us to know as well. So that's kind of the basic exam, and sometimes we end it there, and at that point I'll go over all of that information with the buyer, or the potential buyer, and present all that information and just kind of allow them to have all that information and make the best choice as to whether that's the appropriate horse for them or not. In other circumstances, we'll go forward and do more things. The most common thing that we'll do in addition to that is radiographs or x-rays. And some people go into the exam with a plan that, yeah, on this horse I want to x-ray the hocks and the front feet, or I want to x-ray the front feet and all 4 fetlocks and the hocks. And it just depends on their plans for the horse, their previous history, and kind of how much they want to invest in it financially, getting the most information. Other people go into it saying, well, I don't know if I want to do x-rays, it'll depend on if we find anything on the exam. So sometimes then if you flex the horse and it's positive on one of its flexions, then you'll go ahead and x-ray that joint and investigate that further. Other things that we can do, depending on the exam, would be an ultrasound of some area that's identified of concern in the exam. You can look at the throat with the upper airway endoscopy, putting a camera up there if there's any reason for concern there. You can put a camera down into the stomach and look for ulcers on the gastroscopy. And then we can also go forward and do other things. You can do blood work. A lot of people will want to run a Coggins test as part of a pre-purchase. That's something that's required for a lot of shows and to cross the border, and it's just a good idea to make sure that the horse is negative for that equine infectious anemia disease before you go ahead and purchase that horse. Drug testing is something that can also be done via blood test, and that's something that may be indicated if you don't know the seller at all or there's some reason for concern there. other things that are less commonly done but are possible are getting an ophthalmology consult if there's any concern with the eyes, doing a rectal exam, especially if there is intent to breed the horse at some point, doing a fecal egg count, doing a sedated speculum oral exam to look into the mouth more thoroughly, doing genetic testing, doing nerve blocks, doing a cardiac or ECG exam, and doing more of a breeding soundness exam. And those are things that, some of those things you'll need the consent of the seller to go ahead and do because they are a little bit more invasive, but they would be something that's done on a case-by-case basis. Another thing that we can do as part of a pre-purchase would be to put the wireless inertial sensors or the Lameness locator on that horse as part of the exam. And so we talked about that in previous seminars, and I'm sure you guys are totally up to speed on that, but essentially you're putting little sensors, one on the horse's head, one on the horse's pelvis, and one on the horse's right front foot. And those sensors measure the amount that the head and pelvis are going up and down with each stride. So in a perfectly sound horse, it would go up and down the same amount with the left versus the right. And so it's measuring any asymmetry that's there. So it gives you this looking graph. So the one on the left-hand side is the forelimbs. Each of those blue lines represents a stride. So a perfectly sound horse, it would all be clustered right around the center. And we go to get those numbers on the bottom as well. And so any numbers in the forelimb over 6 are indicative of an asymmetry or a lameness. And on the right side, we're looking at the hind limbs. And in there, we're looking at the numbers, anything over 3 being indicative of a lameness for the hind limbs. So sometimes we put this on a pre-purchase exam and sometimes we don't. It reinforces our subjective opinion that we're giving as to whether that horse is showing a lameness. If the horse is really subtle and it's almost sometimes there, sometimes not, sometimes that'll be really helpful to picking those things up. I think it's useful if as a buyer you're someone that really is interested in minimizing the risk on that purchase. You really are not interested in this horse. If there's any touch of lameness in it, then that's going to be a good option for you. I think it's pretty useful in younger horses that really you want to see them being pretty sound on that lameness locator in a pre-purchase. Older horse, 15-year-old horse that's been around the block a few times, has been campaigned for the last 10 years, is probably not going to be perfectly sound on that lameness locator. And so that's something that it does require interpretation, and it's still very useful to know. And it helps you sort out what might be going on and gives you a baseline gait signature for that horse going forward. So you still might want to go ahead and do it in that horse, but you're doing it for a little bit of a different reason. And it's just, you want to look at it with a grain of salt in those circumstances, and maybe there is some asymmetry there, but whether that's significant or whether it's going to change your purchase decision is up to you to decide in that case. So in terms of why you want to do a pre-purchase exam, one big reason is the fact that the purchase of a horse is a big financial investment for one or both of 2 reasons. The first being the fact that you're buying a horse in the first place, and the second being the fact that even if it's a free horse or a very cheap horse, there is a lot of financial investment that goes into that long term, and if that very inexpensive horse that you just purchased is going to cost you a lot in the long run for maintenance or treatment of a condition that you didn't realize was there, then that's part of your financial investment as well. Emotional investment is also a big reason to do this, and I think it is very important to consider that if you're purchasing this horse for your young daughter who's going to be very invested in that horse and is planning to love that horse for the next 10 years and take it forward and show it. If that's something that in a year that horse is not going to be able to perform as you're hoping, then that's something that's going to be a very disappointing thing for your daughter, and it might have been really important to know that ahead of time. And then potential for resale is another really great reason to do a pre-purchase exam. If there's something that you didn't take x-rays on that horse when you bought it, and then 2 years later you're going to want to sell it and someone else is going to x-ray it, then that would have been a good thing to know ahead of time as well. So if you're going to go ahead and do a pre-purchase exam, things to know ahead of time, the first big thing that we always try to touch on is that we don't pass or fail horses in a pre-purchase exam. And sometimes we kind of talk about that off the cuff like the horse failed or whatever, but truly the horse is not passing or failing. We're giving it all of that information and figuring out what exactly is going on as best we can. But it's up to you to decide if at the end of that, those are risks that you're willing to accept in your purchase of that horse. So it's all about the individual case and the individual owner. The intended purpose of the horse is also very important in looking at as to what type of exam you're going to do and whether you're going to consider any x-rays and whether you're doing the exam in the first place. As well as the age and history of the horse, what it's done in its life, and the intended rider's history and training as well. How they're going to respond to that horse, the amount of training that they're willing to put into that horse, and whether it's going to be a safe horse for that person to go forward and ride. As I said before, the risk tolerance of the buyer is also really important in making these decisions. And when I was telling one of my clients earlier that this is what I was speaking on at the seminar, she said, "Oh, clearly you're just going to talk about the fact that you shouldn't fall in love with the horse before you come." And so obviously that's a bit of a soapbox of mine, but I think that that's something to consider, is that if you've already decided that you love this horse and you're absolutely going to buy it, no matter if I tell you if it has a broken leg, then that's probably not maybe the ultimate attitude to come into the pre-purchase exam with, although you still are able to get some information. But it's good to kind of go into it with an open mind, thinking about what all decisions we can make, what all things we can learn in that exam.